swollen leg at 36 weeks, is it normal? It may be normal, it may be abnormal. It depends on the other things that are coming with it. I don't even understand. So if it's only the leg that is swollen and the blood pressure is normal and there is no protein in the urine, it is normal. It doesn't require any intervention. It will settle on its own. But if the leg is swollen and there is high blood pressure, we might need to treat the blood pressure. If the leg is swollen and the BP is high, then there is proteins in the urine. In fact, in that time, we might be thinking of pre-eclampsia. And the treatment for that one is to deliver the baby. So at 36 or 37 weeks, if the BP is too high, the protein is in the urine, we now have to look for the safest way and the fastest way to deliver the baby. If the woman has had like 3 normal delivery before or 4 normal delivery, we can just give some drugs, bring down the blood pressure and induce her to deliver normally. But if it's a primate, which we don't even know the architecture of the pelvic bone and whatnot, we might advise her for elective CS. 36 weeks, what will make it normal or abnormal depends on other things that it comes with. Just like we have somebody that came to the shop and say, I want to buy sugar. By buying that sugar, you don't even know what you want to use that sugar to do. I don't know if you understand. But if that person now say, give me milk, then give me Bonvita, your mind has started going that this man might want to use it to drink tea. But if that same man say, give me pure water and give me garri, you just conclude that, oh, you actually did this sugar and no garri. That's just the way leg swelling is. Leg swelling alone might not be able to define anything. It is called a non-lateralizing sign in pregnancy. Something has to lateralize it, and that is either there is protein in the urine or there is hypertension. But in the absence of protein in the urine, in the absence of hypertension, then it becomes benign. It has no tendency to cause problem, and we don't treat. Not that we cannot treat, we can treat, but the consequences of the treatment might be detrimental to the baby. Even if you give the woman like this, the leg will go down. I don't know if you understand. But giving her that drug that will cause the leg to go down might compromise blood supply to the baby. And when that happens, nobody wants to dry a leg and kill a baby. It doesn't make sense. I don't know if you understand. So when we say it is not treatable, it doesn't mean there is no drug to treat it. There are so many drugs that can treat it. Except in very, very rare occasion when there is congestive cardiac failure or whatever in pregnancy and the legs are swollen. That time the life of the woman is threatened. You can give some drug that will reduce the swelling. But that was because the life of the mother is what? Threatened. But if the life of the mother is not threatened, it's just the leg swelling, you don't have to do anything. You don't have to do anything.